One traditional role, going back to maybe the 1950s, in terms of pharmacists' role in cardiopulmonary resuscitation, involves medications, which most of us as pharmacists are quite familiar with. So this involves pulling the medications out of the crash cart, facilitating obtaining doses needed during cardiopulmonary resuscitation, as well as drug information as well too, such as IV compatibilities, an example being sodium bicarbonate and calcium can actually precipitate. It forms chalk, calcium carbonate. So aspects such as that, among dosing questions, etc. Normally during codes, I'm usually the one that is making sure that we're giving the epinephrines as indicated based upon the ACLS guidelines and ultimately keeping the tempo of the code event. In some cases, pharmacists might be able to administer medications as well too, depending on state and institution regulations and policies. I hope in the future that pharmacists will have a bigger role in terms of medication administration. I think it's a valuable opportunity for us to have in the future in terms of lending a hand and helping out the ultimate code effort, especially in cases where code teams might be somewhat understaffed or not enough present at the code. Other aspects pharmacists can help out with as well, jumping in with other aspects in order to benefit patient care and affect outcomes. We know based upon the evidence that chest compressions and defibrillation are two of the main aspects that save patient lives. We go through basic life support training every 2 years, most of us. I highly encourage pharmacists to utilize these skills. An interesting thing to note is that very few pharmacists have actually performed chest compressions. I encourage you to jump in as pharmacists, perform chest compressions. The way I look at it, I'd much rather have my first few times doing chest compressions among a code team and make sure I get good feedback and that I'm doing it right before the time comes where I might have to do it in the field and do bystander CPR for someone who maybe went down. Similarly, as I mentioned before, pharmacists can also do the defibrillation, press the shock button every 2 minutes if the patient is in one of the rhythms that would indicate defibrillation as well too. There's other aspects as well too. There's no reason pharmacists can't deliver respirations via a bag valve mask, which I've done numerous times myself as well too. It's interesting to note that typically, in many cases, pharmacists are of the most consistent responders as part of the code team. After a post-code debriefing one time, one of the medical residents I worked with actually said that he felt that pharmacists are the keepers of the algorithm, the advanced cardiac life support algorithm, which I think is a compliment to us as pharmacists. This is likely because many of us respond to a lot of codes quite frequently. If you think about the sheer numbers of pharmacists that work in an institution versus nurses and physicians, it makes sense that pharmacists actually accrue code response experience quite rapidly. And to that medical resident's point, he basically points to the fact that not only are medications, pharmacists help out with medication-related aspects as part of the code team, but also in many cases we're keeping the tempo. We're making sure that shocking occurs, defibrillation occurs every 2 minutes, the rhythm checks occur every 2 minutes, etc. So we kind of have that overarching perspective and experience to help out with that. Also, pharmacists too, from a code during cardiopulmonary resuscitation standpoint, can help out with what I consider to be a pharmacist assessment. Some might consider this to be looking at some of the H's and T's, as we call them, which are reasons for why a patient might have went into cardiac arrest. Very often during code events, I'm one of the main individuals trying to learn why the patient might have gone into cardiac arrest. Maybe it's hyperkalemia, maybe it's a dialysis patient who has not been dialyzed for several days. We might give calcium in that case. Maybe the patient might have been extremely hypovolemic due to dehydration, so I might be the one pointing that out and recommending that we give fluids, among other aspects as well. Outside of those aspects, pharmacists also have a role in documentation as well too, not only medications, but can also extend beyond that, such as rhythms the patient is in, etc. I can't tell you how many times where maybe the last dose of epinephrine is not known, or maybe it is unknown when we started the initial code effort. And these are some elements that pharmacists can bring to the table. Not to mention precepting as well too. During code efforts, there's numerous times where I have students or other learners with me where I can help develop the future of the pharmacy practice and model and really give them a good experience and learning to go forth and be able to do it in their own practice. After a code effort, though, the job isn't done for pharmacists too. There's multiple considerations. One aspect actually has to do with what's called targeted temperature management, which used to be called, some institutions might call it cooling protocol, etc. Long story short, certain patients might be eligible for being essentially chilled, brought down to monitored hypothermia, because it's been shown that this can increase survivability as well as neurologic function after a cardiac arrest, ultimately making sure that they leave the hospital the same person that they were before they came into our care. As pharmacists, there's numerous times where I'm one of the main drivers of the targeted temperature management, making sure that we give some initial cold saline. As you can imagine, when you cool someone, they can experience shivering. So I'm one of the main people make sure that we manage that shivering, because prolonged shivering can have its own complications as well too. As well as other aspects such as blood pressure management. After a code, many patients can be hypotensive. So usually as a pharmacist, I'm one of the main people make sure that we're giving medications necessary to keep the blood pressure up, among other aspects as well.